Cancer is a continuously growing global health problem that poses major challenges, most especially in developing countries. Find out how this international distributor of innovative health products came up with a series of solutions to help increase a patient's chance to survive the odds. In 2020, the Philippines hit a record of 354,398 prevalent cancer cases within a 5-year period. But because of poor access to health care, especially for people living below the poverty line, the advances and breakthroughs in cancer remain unattainable to many.
Cancer refers to a group of diseases that's characterized actually by cell growth, abnormal cell growth and proliferation, inflammation, as well as angiogenesis or formation of new blood vessels. It always starts with mutation in the genome or the genetic makeup of a person inside the cell. Before PPARs, most of my patients, they were unable to finish the chemotherapy regimens because of the side effects and because of discomfort during the process of chemotherapy.
Maria's son Dominic was diagnosed with stage 4 rhabdomyosarcoma when he was only 4 years old. While coping with the recovery of her other sick child, Maria found it hard to accept Dominic's condition.
It was actually very devastating kasi with Dominic, it was manifested mga 4 years old na siya eh. Unlike dun sa daughter ko na congenital talaga, baby pa lang. Yung mga bandang September, meron ng umuumbok-umbok dito sa leeg niya. Hindi ko talagang iniisip na cancer kaagad siya until nag-nosebleed siya.
Dominic was prescribed chemotherapy, but his family insisted to rush to an integrative doctor to seek for alternative cure.
Medyo hesitant ako kasi as a mother, I know the side effects ng chemotherapy kasi. So what I did is that I rushed towards the integrative doctor of my daughter, who happened to be PPAR partner doctor of Jansen and Mr.
One of the hardest decisions to make for people living with cancer is choosing the kind of treatment that would work best. To help patients and their families deal with this growing health problem, one company commits to producing safe, credible, and natural health solutions by drawing on the latest bioscience technology to deliver a series of safe, efficient, and natural products. What is Simply Nature and what does it do?
Simply Nature is a company we created and founded about 10 years ago. Our mission is to find effective health solutions for people. So we provide natural products that work in combination with conventional therapy and medicine.
As an international company that provides natural solutions for cancer, metabolic syndrome, and degenerative diseases, the management upholds a health philosophy that centers on whole food nutrition as the frontier in health management.
When we talk about choosing treatment, especially in the area of cancer, patients are really afraid of chemotherapy because of its side effects, and they tend to then look towards natural products. But this is not either conventional or natural choice. At Simply Nature, patients can have the best of both worlds. Our protocols work with conventional chemotherapy to minimize its side effects so that they can get the best treatment using both conventional and natural together.
Cancer is like a virus. It continuously evolves, it mutates, so it can develop defenses against our usual treatment modalities like chemotherapy.
Like I said, chemotherapy and radiation therapy have a lot of side effects. So more often than not, patients stop their treatment because of these side effects. It's very important to have the support.
With the supplements that we give the patients, there will be lesser side effects, so they will be able to finish their chemotherapy protocols more comfortably.
This company introduced PPARs, which is touted as one of the best natural ways of solving serious health problems.
PPARs stands for peroxisome proliferator activating receptors. It's basically a nuclear receptor found inside the cells. Now, when these receptors are activated, the benefit that you can get from that is, number one, cellular differentiation. Number two, it's to promote fatty acid metabolism. If you have better insulin function, your blood sugar will naturally go down. And another one is to induce cancer cell death by modulating the immune system.
As a sole distributor of PPARs, the company promotes its use to many reputable health institutions worldwide and actively organizes corporate health conferences and public health talks in Asia.
Simply Nature PPARs is made out of a special strain of these types of microalgae. It is very effective by protecting the bone marrow. We maintain the integrity of the immune system of the patient, which is very important to prevent infections and to fight off the cancer itself. And also, Simply Nature PPARs is also very dense in nutrients so that the patient can recover faster because of better cellular healing.
Sabi ko parang na-lead kami to an extraordinary and I must say amazing journey. I'm very proud of him. At a young age na 8 years old, he believed that it's his purpose to siguro encourage other people then. We would like to really pay it forward with the knowledge that there's really like Simply Nature that can help people with cancer very much.
When fighting cancer, living healthy is very important because it allows us to pursue what is important to us in life, and that's what it's all about. When we can help a patient move from being bedridden to getting up, to be lucid in thought so that they can have conversations with their loved ones, it gives the whole process of fighting cancer a whole new meaning. And that is what drives us at Simply Nature.
Talagang sobrang sakit. Sumusuka na ako. Tapos sa work ko rin, hindi ko na kaya talagang mag-isip. Dumating ako sa point na nawala na din daw ako ng malay. Then, nakilala ko si Sir Shrank. Meron silang ganung product. Effect sa akin ng supplement na to is malakas ako. Kahit nagkikimo ako, nagre-radiation ako. Hindi ko naranasan yung mga naranasan ng other patient na nagsusuka, nanghihina, walang ganang kumain. My name is Saida C. Gomez, 48 years old. I live in Quezon City. Currently work is a property manager. Diagnosed sa akin is breast cancer no year 2019. After 2.5 years, is recurrent na siya for stage 4. Affected na yung brain, then lungs and liver. Kumalat na siya. Yung symptoms na naramdaman ko is talagang sobrang sakit ng ulo ko. Gumising ako, parang sumusuka na ako. Tapos yung umiiba-iba yung way ng walk ko. Talagang as in, vomit dito, vomit dun. Tapos sa work ko rin, talagang hindi ko na kaya talagang mag-isip. Parang lagi akong masakit talaga ang ulo. Na dumating ako sa point na nawala na din daw ako ng malay. Sabi ng mga kasama ko doon. Inaakay na nila ako. Then, yung pinakamatindi is yung dito na sa bahay na talagang inaano ko nung husband ko na ginigising ako pero talagang ayaw kong gumising. Kaya dinala na niya ako ng ER. Tapos doon na sila nag-test. Nagising na nga lang ako, nasa room na. Parang minuto na nga lang, wala na ako. Kasi talagang yung namamagana, swollen niya yung brain ko. Nang ma-diagnose ako ng 2019 na I have a tumor, bukol, hindi ako nagpa-chemo. Basta it's natural, concentrate ako sa natural. Then, after ng 3 months, sabi nila, is kailangan ko na daw ipatanggal. So, hindi na siya babalik. So, pumunta ako ng hospital, natanggal naman siya. Then, still, natural pa rin na product na aking tinitake. Pero, bumalik siya. Stage 4 na. Kasi nga affected na yung brain ko, lungs, liver. Actually, may ano na siya, sign na para sa bone. Yun yung mga nakita sa CT scan ko. Then, nakilala ko sa Sir Shyan na meron silang ganung product, PPARs, na powder and tablets. Yun yung trinay ko habang nag-start na ako ng radiation ng 18 May, nag-chemo na ako. Natapos ko yung radiation ko for 10 session. So, okay yung effect. Nakayanan ko siya. May, nag-start na rin ako ng chemo para dun sa lungs and liver ko. And yung abdominal, kasama na rin siya. Every 21 days, 3 days yung aking chemo. With the help talaga nung Simple Nature, hindi ko naranasan yung nakikita ko sa mga kasabayan kong nagkikimo na nagsusuka, sumasakit, giniginaw, may mga ganun, tapos parang hindi talaga sila makakain. Minsan nga, hindi nila natatapos yung treatment nila. Pero ako, natatapos ko siya, is 3 days pa, na ang recommended sa akin is dapat naka-admit ako ng 3 days. Since tight lang din ako sa budget, is nag-decide na lang ako mag-uwian. Kasi strong ako, kaya ko. The following month ulit, nakaya ko siya ng hanggang 5 cycle. Di ako nagsusuka, nagugas ng plato, may konti akong pinagkakabalhang tindahan. So, nagagawa ko. When I was diagnosed sa stage 4 cancer, I cried, of course. Hindi mo naman maiiwasan yun. Pero I never felt na hindi ko kakayanin. Parang kailangan ko lakasan ng loob ko para sa family ko, lalo na sa mga bata, sa mga anak ko, maliliit pa sila. Yung husband ko, naiyak siya, syempre. Pero nung makita niya akong lalaban ako, parang nadagdagan yung fighting spirit niya na talagang lalabanan natin to, mami, sabi niya ganyan. Narinig ko nga sinabi ng doktor na less than a year ako, pero hindi ako kinabahan. Tinitake ko is PPAR powder, 2 scoop, nilalagay ko siya sa ilalim ng dila para ako matulog. Then 15 tablets every morning, empty stomach. Then sa afternoon din, 15 din ulit. Bumibili rin ako ng cleansing para panglinis. During chemo, radiation, ginagamit ko siya. Effect sa akin ng product, ng supplement na to is malakas ako. Kahit nagki-chemo ako, nagre-radiation ako, hindi ako nanghihina. Kaya kong bumalik sa normal na kilos ko after ng chemotherapy ko. Happy ako sa mga result kasi after 3 months, pinag-CT scan na nga nila ako at saka MRI. Good yung development. Nabawasan lahat yung mga measurement. Siguro yun yung effect talaga ng supplement na tinitake ko. This month is naka-evaluation. PET scan na po ako. Happy ako dun sa result ng CT scan at saka MRI. Kasi nga, yung sa MRI ko, yung sa brain is from 1.09 naging 0.08 na lang siya yung measurement niya. Then yung sa lungs ko, which is yung chest scan ko, is 9.05 naging 4.05 na lang. I will recommend Simple Nature to other cancer patient kasi it's very effective for me. Kahit nag-treatment ka at tinitake mo yun, hindi ko naranasan yung mga naranasan ng other patient na nagsusuka, nanghihina, then walang ganang kumain. Hi, I'm Saida Gomez. I have stage 4 breast cancer, metastasis for the brain, lungs, liver, abdominal, and bone. Thanks to Simple Nature, I'm okay now. And I trust Simple Nature.
Hello and good evening, everyone. My name is Sheila and I'm your host for tonight. You are watching another episode of Simply Nature Webinar, your long-time running healthcare awareness webinar here in social media. This program is powered by Simply Nature International and Simply Healed Medical Group. Last week's webinar discussed about the possibilities of inheriting breast cancer, and Breast Cancer Awareness Month may have ended, but we are not stopping our efforts to spread awareness about this disease. Tonight's topic is entitled Cancer Tumor Shrank Down with PPAR's extracts. We appreciate each and every one of you who registered and shared this online event tonight. Our topic for tonight tends to bring you hope, so be part of this pivotal moment in the fight against cancer as we unlock the secrets of PPAR's extracts and their profound impacts on tumor reduction. To start off our discussion for tonight's topic, I'd like to call on a successful entrepreneur who is also a seasoned international speaker from a wide range of topics from personal success to healthcare, the CEO and founding director of Simply Nature International, Mr. Shyan Lim. Good evening, Sir Shyan.
Hey, good evening, Sheila, and good evening to all our viewers today. I'd like to extend a very big thank you for being here tonight because it's Holy Week. It's Holy Week, right?
Correct. It's holiday.
Okay.
All Souls Day.
It's Holy Week in Philippines, and it's almost a 1-week holiday because Monday's a holiday. Yesterday, Wednesday, today, Thursday is a holiday, and only Tuesday and Friday is a work day. Of course, many people took leave so that they had the whole week off. And that's why, but we made a promise, right, Sheila, that we will make this show available, this live cast, rain and shine, holiday or not. So we're very glad that everybody is here tonight joining us. Tonight's program going to be a bit special because we're going to focus on PPARs tonight, right? So we're going to talk about, so prepare all your questions that you want to know about how PPARs can help shrink tumors and treat your cancer. So without further ado, I think we have a very interesting but short discussion by Dr. Jansen. So I'll let Sheila introduce that. But I will be back immediately after the brief discussion by Dr. Jansen. I think it's less than 10 minutes. All right. So don't quickly stay online because we'll go to the Ask Me Anything segment where you can ask any questions you want. All right. So I'll hand the time to Sheila. I'll see you guys in about 10 minutes.
Thank you, Sir Shyan. That is so true. It's actually a holiday today, but we understand the urgency of your health concerns, particularly in cancer. That is why we are here for you tonight. Now, to start off our discussion for tonight, let's welcome our Dr. Jansen Kalalan, a graduate of St. Luke's Medical Center, College of Medicine in 2016, and in 2019, he was conferred as a diplomat of the International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine. He is also the president of Simply Healed Medical Group and a consultant at Alta Integrative Medicine Wellness Complex at Perpetual Health Medical Center, Las Piñas, where he manages patients with cancer and metabolic illnesses. Let's watch this.
Let's all welcome the president of Simply Healed Medical Group, Dr. Jansen Kalalan.
Now, let's go to a very short case presentation to give you a glimpse on how the patient experience is. No? So let me share with you the story of one patient of mine. So this is a 23-year-old female who complained of abdominal fullness, fever, and low back pain. Now, in 2015, upon ultrasound, it was found that she had an ovarian mass. She underwent surgery and her right ovary, right fallopian tube, appendix, and the omentum were removed. The omentum is a tissue that wraps your intestine. Okay, that's the omentum. Now, the post-surgical findings show that she had a mixed germ cell tumor, stage 1, at this point. However, 2 years later, the patient again complained of an abdominal pain, no? Now with increase in abdominal girth. So she had an increase in her waistline. Then, of course, she sought medical help, and it was found that she had metastasis already in her liver, lungs, and bone. Okay? Also, the mass in the liver infiltrated the diaphragm. Then, because of this, she underwent 8 cycles of chemotherapy to shrink the tumor prior to surgery. After she finished chemotherapy, she underwent surgery again for the removal of the tumor invading the diaphragm. So this is February 2018. However, 2 months later, she again noticed an increase in abdominal girth, now with vomiting. It was also found that there's another mass at the diaphragm, okay, and she had to undergo another surgery again to have it removed. Okay, so in the next few years, she was just undergoing monitoring and nothing was being given to actively shrink the tumor. Come November 2022, the liver mass was measured to be at this size, no? 2022 size, around 2 centimeters from a size of around 3, which is this is a slight decrease in size according to the CT scan findings. But when I tried to compute for the reduction in volume, this is actually quite significant, around 50% reduction in size. Actually, it is during also this time that I started to handle the patient, and the treatment plan I gave her is for her to eat a whole food plant-based diet, okay, with Simply Nature PPARs and PPARs plus tablet. So with the treatment plan, I think you already know who this is, no? So next, in around May 2023, the patient underwent ultrasound, no, which showed 2 dermoid cysts in her left ovary with the following sizes. And her OB just advised observation, and nothing was done. So on my part, I just told her, okay, continue PPARs. And in August 2023, an abdominal CT scan was done, which showed that the liver mass had a slight decrease in size, now measuring around 1.97 by 1.5 by 1.66, which was previously around 2 by 1.5 by 1.9. So this is around the 14% reduction in size. Also, 2 gallbladder stones were also detected, which explains why the patient had occasional abdominal discomfort after eating. Okay, furthermore, this is what is amazing. I just don't know if it's just the CT scan, but there were no cysts found at her left ovary.
Wow.
Okay, let's go back a few slides. Ultrasound, 2 dermoid cysts, left ovary. At this point, no cysts were found already at the left ovary. I think I had a very small screenshot of the laboratory of the CT scan result. But anyway, that's what it read. And there were also no enlarged lymph nodes found in the abdominal region. Okay, so final diagnosis is gallbladder stones, mixed germ cell tumor. But at this point in time, it's already resolved. Okay, so this is what I did. I just added 1 ursodeoxycholic acid to try to dissolve the gallbladder stones. Then repeat again the CT scan after 6 months. Okay, so that's it.
For that very informative discussion. I'm sure that our viewers have learned so much tonight and has a lot of questions in mind as well. Now, just before we go to our AMA, I just want to quickly greet our avid viewers, starting up with Miss Lily Lunio, of course, Miss Edna Aveo, and for our new viewers, welcome once again to our Simply Nature webinar. So let's not keep you waiting. I'd like to call on once again our CEO of Simply Nature and our PPARs expert all the way from Singapore, Mr. Shyan Lim, to answer all our questions for tonight. Sir Shyan, are you ready?
Yeah, I'm ready. You know, for everyone that's watching, we still have good viewership. Okay, that's one thing good. So I hope everybody is having a good rest this week. And the clip that you saw today, really short, right? But it's actually from our October 14th event. All right, we had a live event. I want to thank all of you who came on October 14th. If you were there on October 14th, please type in the chat box, I was there. All right. Okay. Maybe Junie, if you can prepare the 1-minute video of our October 14th event, just let us know when you're ready. All right. I just want to so that we can show everyone. I wanted to share with everybody that the event was very successful. It actually had a very moving end. towards the end of the event, the audience itself, the people, the viewers that came live to the event, a few of them shared very touching, I guess, testimonies, their journey in cancer. And a few, all the patients over there found the answers that they want, you know, immediately. What was good in the event was that we had Dr. Jimmy Kapia, who is one of the top oncological surgeons, who answered very poignant questions about surgery. So there were people among the audience who were going to make decisions on whether to go for surgery or not, and they got the answer they wanted, right? And immediately also, because Dr. was also there, so there were quite a few patients who got to talk to one doctor, then quickly go to talk to the other doctor after the event. So they got to hear from the lifestyle medicine side, the integrative medicine side. They also got the oncology side, because Dr. Jimmy also prescribes chemotherapy apart from surgery. So everybody got real answers. I'm sure, you know, just like our program, people love our program, and you guys ask so many questions during the AMA, because, right, Sheila, as a patient, if you see an integrative doctor, maybe they will tell you don't do chemo and things like that.
I agree with that. Totally agree with that, sir.
And the reverse is also true, right, Sheila? If you see oncologists, they'll tell you don't take supplements or something like that.
That's true. Quite really the opposite.
Yeah, so, you know, we had two doctors from two different schools sitting side by side with one another, and they were able to answer the questions in a way that makes sense. And of course, they complemented one another. So they cleared up all the confusion. So if you were ever confused, that panel on October 14th was wonderful. And I think the most momentous question, someone asked about how much does it cost?
Yes, about that as well. Yes, but
Yes.
I just want to echo out what you said, sir, because one good thing about Simply Nature, and I think a lot of our patients have also vocalized this as well, is that we are here in Simply Nature. We don't want our patients drifting away from their doctors. We actually want them to have a good relationship with their doctors in their hospitals alongside their treatment. So that is one thing that I personally, before, I appreciate. And I guess our patients right now are also appreciating as well.
Yeah. Yeah. So
I think, sir, go ahead.
I see a lot of questions, but I just want to finish this comment. And I think it's Junie is ready with the video, right?
Yes.
So before we go to the AMA, I'll just let everybody see the video. And I see your questions. Let me acknowledge there's a question that asks about, can we shrink the tumor just with PPARs without operation? Can we use PPARs to cure heart diseases? I will answer those things. Now, I just want to say one thing about that. On the day itself, October 14, we answered this question. And one thing nice about our program and the doctors that we bring onto our panelists is that we do straight talk. Right? We just tell you the truth and then give you solutions on how to manage things. So we had to acknowledge one thing, everyone tonight. You know, when you have cancer, the fight for cancer is also about how deep your wallet is. You know, the more money you have prepared, the more options you have. Now, I say you have more options. Now, it doesn't mean that if you don't have so much money, you have no options. No, there are many patients who come from very poor families. They are now just that if you have more money, you have more options, all right? But no matter what your budget is, there is a protocol that will give you a good chance to win your battle against cancer. Of course, if your budget is smaller, you have to be more disciplined, all right? Maybe there's a little bit more inconvenience, all right? Maybe the fighting of cancer is not as comfortable compared to use more protocols to make that journey, the cancer journey, fighting cancer a bit more easier, right? Maybe less pain. But it doesn't mean that if you don't have the budget, you cannot treat and successfully beat cancer. There is a proper protocol for whatever budget you have, all right? So we want to give you hope. We want to give you clear directions on how you can go. So let's take a look at some clips from October 14, because we're going to have another live
face-to-face event
like this, face-to-face in the beginning of 2024. All right.
Pro-prevention is not waiting for bad things to happen. It's preventing things from happening in the first place.
Marami po akong natutunan dito sa seminar na ito.
I would recommend it to people who have illnesses, even cancer, and even you consider as critical illness.
Okay? So imagine this, you have roots, you have the tree. The risk factors are the roots. You have a rotten fruit, that's what the cancer is. The one that's feeding the tree or the rotten fruit is the root. So I have to address the root.
It's a group of health professionals passionate about educating and helping people live the best, most fulfilling life possible. And that's our wish for everyone.
We are always with you from start to healing!
Oh, it was really an exciting event, Sir Shyan, and I look forward to the next event that we will be having in 2020.
We actually had a full house. I was kind of worried because we started the program at 8:45 a.m. on Saturday. There were actually participants who arrived at the same time I did, at 7:30 a.m. All right. Those participants were coming from the province. As you can see from the video, everybody towards the end of the program, they were, cheering together as a team. It was pretty much a full house, and hopefully they kept asking us. So I do pray that our next face-to-face will have maybe 150 people, right? And that will continue to grow, because we really want to be able to answer the questions of patients and viewers like yourself. And of course, you can come to these programs. You can always ask questions that are not cancer related also, but not too many, right? Because it is very focused on cancer. And we're very exciting. We are lining up some new panelists, lining them up, we're discussing with them. So come 2024, I think February or early March, look forward to that. Okay, Sheila, let's go into the AMA.
Excellent. All right, so the first question that we have, this was thrown in privately by Miss Merlinda of Bulacan. How many months does the patient will take the PPARs to become cancer-free?
All right, okay, this question is a very good question. It's a question that varies, all right? Okay, why do I say that? The difference between, let's say, Simply Nature PPARs and, for example, chemotherapy. Chemotherapy works on the cancer tumor. Many clinical trials. That's why when you go and see an oncologist, a doctor, they'll tell you you need to go for 8 sessions, you need to go for 12 sessions. They will see the type of cancer you have. They'll look at the size of conditions. They will do a biopsy and do some tests, right, to see which chemotherapy drug is suitable for you. And they have extensively tested the chemotherapy drug on the cancer tumor. So they know it will take 8 sessions to hurt or to shrink the cancer tumor by this much. It's like you baking a cake, right? You know exactly how long to put the cake in the oven, because it's like a recipe. You bake the cake itself, right? Now, for Simply Nature PPAR protocol, we don't act on the cancer tumor. The protocol, Simply Nature PPAR extracts, act on your immune system, all right? It acts on your immune system. So for example, let's use the cake example, right? Let's use a cake example. If you're going to follow a cake recipe for strawberry shortcake, okay? So you want to make exactly the same strawberry from your favorite bakery. You got the recipe, you just follow the recipe. So you'll know exactly how much flour to make, how put in, and so on and so forth. So it's just like chemotherapy. They'll tell you 8 sessions, you should see this result. Okay. Now, what's the difference when you use Simply Nature PPARs? Following the recipe to bake the cake, you are getting a better baker. Okay, so now professional level baker. So he is more creative. He may make changes to the recipe because who follows a recipe. He's an experienced baker, and he's gonna be a bit more creative so that the cake can come out even more delicious, more wonderful. So you know what that baker is going to do different, right? Because you got a better baker. You didn't use just a fixed recipe, you got a better baker, someone who's better at baking, more creative. Nature PPAR protocols. We work on the immune system. All right. So your immune system will then attack the cancer tumor. And not only that, we also reduce inflammation, which makes it difficult for the cancer to grow. Means that everybody, the amount of time it takes for a person to see result will vary. However, there are still guidelines, right? There are still guidelines. So as soon as 1 month, 1 to 2 months, you should do diagnostics. For example, go for a scan. You should be able to see whether your tumor has shrank or stopped growing, right? Then you can make adjustments to the dosage. So let me give you the range. We will see results usually within whether the tumor stopped growing or whether it's shrinking. Now, how fast is the best results we've seen? The most amazing results that we have seen is the one where one of our patients had six, if I remember, 5 or 6 brain tumors, cancer tumors. Because it's so many, you can't operate. And to do chemotherapy, the dosage for 5 tumors in the brain is. So the patient opted just to use Simply Nature PPAR extracts. And guess what? I think it was under 1 month. He went for another brain scan. Everything was clear. Okay. Another one that I personally know from the doctor, who at that time is Dr. Angie Domondo, my Ninang, or my godmother. She had a patient who had breast cancer. And it was so bad that it was open wound and smelling. And the best thing to do for breast cancer like that is literally just to do a mastectomy. That means just to cut off, because the whole breast is as hard as rock. All right, and it was already breaking. There was pus, there was sore of the lady's breast. I mean, if you were the patient, you would be really worried also, because it's open sores and pus and everything. But they couldn't operate on her because her cancer tumor is fused to the bone.
Mm-hmm.
It's stuck to her chest, her rib cage. So they couldn't operate on it. They couldn't remove it. So she took the liquid extract. Less than 1 week, the breast tumor softened and detached. That means it's separated from the bone by itself. So quickly, the patient opted to have surgery the moment the breast tumor softened and detached from the bone, which allowed the surgeon to do a mastectomy. So I'm just sharing with you the best case scenarios. However, it should not take more than 3 months for you to see results. Okay, now how good the results will be? It could be that the tumor stopped growing, the tumor starts already shrank. However, you should be able to see results to know whether this protocol is good for you. You will know actually as soon as 2 weeks, you will feel the difference in your body. If you start to feel stronger, you're in the right direction. All right. Yeah, I hope that answers your question.
Thank you, sir. We are starting off really positively with very encouraging, with your very encouraging answers, Sir Shyan. Thank you. All right, so our next question coming from Ms. Leslie Devonish from Florida, US.
Florida, welcome.
Yes, thank you for watching and joining us tonight. Now the question is, can PPARs relieve pain?
Okay, PPARs is not a pain reliever. Okay, it's not a pain reliever, but it removes the cause of the pain. So for most patients, the cause of pain is the inflammation. All right, and of course, for patients whose cancer like breast cancer that breaks the skin is also the infection, so on and so forth. Now, PPARs is able to reduce inflammation, modulate the inflammatory response. So in this way, it actually reduces pain. Okay. It's not like morphine, all right? If you take morphine, these are painkillers, all right? So it numbs your body's sensation of pain. But PPAR actually stops the reason why you feel pain, because you have inflammation, there's infection, so there is the pain, right? So that's how PPAR can help with pain. Now, I actually have, I know, for example, this one are personal, many times we work with doctors. So the information we get is secondhand. That means the doctor tells us what their patient is experiencing, right? With Dr. Jansen, easier because I'm so close to Dr. Jansen. I see him very often, right? Every Thursday, right? Now, I do have personal experiences with the patients that we work with. Now, one of the most painful types of cancer that is caused by cancer is when the cancer metastasizes to the bone. It becomes very painful. Okay, so usually you will be on morphine to manage the pain. I can share with you the patients who had cancer metastasized to the bone, when they first started using the extracts, they felt improvement, they felt some relief, all right? However, as their treatments go by, their body could become weaker, and then when your body is weaker, it deals with inflammation. It has a more difficult time dealing with the inflammation, so that the cause for the pain becomes stronger. So imagine if they didn't have PPARs, I believe it would be even more painful. I was just having a discussion with another doctor when we were taking a look at pathophysiology, which is how your body chemistry works. I forgot, we were talking about mechanism, but again, the PPAR doesn't work on the pain itself. It works on the root cause of the pain that you feel as a cancer patient. It definitely helps relieve fatigue. It helps you feel stronger, and all that makes the pain management better, right? Can you imagine if you're very tired and painful at the same time? It makes it even more difficult to endure the pain, right? Because you're so tired and weak and it's painful. But if you're stronger, it's easier to deal with that. So yes, it will improve or help you manage the pain, but not the same way a painkiller does. It works on the root cause of your pain.
You've mentioned a while ago, sir, about PPARs having an impact on the immune system and, of course, the inflammation. I guess this makes sense because our patients who are taking PPARs alongside their chemotherapy are not having, tremendous pain even during the session that they're having. So I guess this explains how it works.
That's
right?
true, right? I think one of Dr. Jansen's best patients is Cecile. She had third or fourth stage breast cancer. She was metastasized to the bone, so it's supposed to be very painful, and she was having a very difficult time with her first bout of chemotherapy. She was reacting really badly to it. She took Simply Nature liquid extract. She felt so strong she was going out to the mall shopping during the pandemic. Dr. Jansen was actually saying that he was worried as a cancer patient that she will catch COVID, So that's one example. Our product is not a painkiller. It's not like you take morphine or marijuana, cannabis, right? to be able to manage pain this way, but yet it does have the effect of reducing pain. Another good example is this, right? Our product, our PPAR extract, is very good for psoriasis and psoriatic arthritis. So those are people with a lot of joint pains. They take the PPAR protocol, the pain goes away or goes down, right? So yet we don't have a numbing agent. It's not like morphine. You feel so happy, so light. No, it's not that. It actually gets rid of the thing that causes your pain. So the pain scores for those with arthritis, psoriatic pains actually drop. The patients actually say it's less painful. So it works the same way for a cancer patient. And you got to imagine, as a cancer patient, whatever treatments that you may be taking together with your cancer is putting a lot of stress and a lot of inflammation in your body, and that causes that pain.
Even better, it's all natural, 100%.
Yeah, it's natural.
All right, next question coming from Ms. Josephine Chua. Can tumors shrink with only PPARs without operation and religiously following rigid protocols? Thank you.
Okay. Asking me if it's possible, the answer is yes. If you ask me, does it happen for most of the patients, the answer is, also yes. If you ask me, should you or should you not go completely natural, I would say it depends on your case, right? Let me ask a person that very good to answer this is this. Let me interview Sheila herself, all right?
Okay.
Okay, so I'm not sure, to the new viewers, you may not know. And I think what I like about our program is that we're not talking in theory. And we're not just talking as practitioners as well, you know. Number one, my dad is a 2-time survivor of throat cancer. And so it's very personal too. My aunt died from stomach cancer just 3 years ago. All right. So it's not something that is like we're just the doctors or the healthcare specialists. No, our own families went through the, I guess I would say, tragedy or a very difficult trial. And for Sheila, it's her very young son. Dominic was about 4 years old with 3rd stage, 4th stage nasopharyngeal cancer. So Sheila, you as a mother, right? Did you want Dominic to go for chemotherapy?
Not right away, definitely.
You didn't want?
I didn't, of course.
Why?
I was afraid, of course, of the side effects of chemotherapy. With that young age of 4 years old, I was so scared for him to undergo that.
What do you think would happen to him if he went for chemotherapy?
It wouldn't go positively. That was what I was thinking before. That is why I also searched for an alternative option as well.
Okay, so Sheila is answering in a very realistic and honest way, which I think many of the viewers, whether you have a child who has cancer or you're a grown adult who maybe you are the cancer patient, you probably have the same fears that you won't react well to the chemotherapy, that the side effects going to affect you, right? Okay, so you actually went not to an onco, right? You went to an integrative doctor. That means this doctor is using alternative and natural treatments. Although the doctor is an MD, right? She's an MD.
She is an MD.
She's MD. She's actually one of our doctors. So what did that doctor tell you?
Well, I've shown her everything, the laboratories, the CT scans. I was really hoping for a good answer that which I want to hear. Like, okay, yeah, your son cannot go for chemotherapy. But she was the one who actually begged me to go for it because my son's case was malignant and aggressive, and it was stage 4. So, but one thing that I cannot forget with what she said, you have to go for chemotherapy, but not for chemotherapy alone. That's what she said.
Yeah, she said if Dominic only did chemotherapy, his chances of survival was not going to be good.
Yes, that's what she said.
So he said that. So this is the difference between an integrative doctor and just an onco, right? The onco will say, go for chemotherapy. That's the only way. Even a natural or integrative doctor, but this one is an MD background, right? So it's not a natural path. This is fully a doctor who finished med school, is a registered. Actually, I know the doctor. She's actually an ER doctor that went into integrative medicine. She actually said you have to go for chemo, but if you just do chemo alone, your son probably will not survive. So this is it's very different answer from just a pure oncologist who will tell you take chemo and don't do anything else, right? So here is a medical doctor who says you got to go integrative, that says you got to go for chemo, but you can't just do chemo because your son won't survive. All right, so this is what I'm saying. So if in certain situations, especially if your cancer is very aggressive, all right, is for example, lung cancer, small cell lung cancer, very fast. Usually if you are diagnosed with that, you're given 5 months, all right? Nasopharyngeal cancer, any cancer in the 4th stage, right? If you are healthy, if you're strong, chemotherapy would be an option to slow down the cancer because it's very aggressive, right? It's very fast. Even if you have 3rd stage prostate cancer, okay, this is debatable, right? But if your cancer is caught early, like 1st stage, 2nd stage, as long as it hasn't hit 3rd stage, if you want to try natural, it's a viable option. Are there risks to it? Yes, there is. But if you are very concerned about if you're very clear you want natural, yes, you can try. Now, how would I go about, what's my advice about attempting to treat cancer naturally? All right, you got to have a red line. That's what I'm saying. you treat the cancer naturally, but you got to tell yourself, after 3 months, if the tumor is not shrinking, I have to really explore chemotherapy, immunotherapy,
Yes.
right? And use it together, right? You don't say stop your natural therapy, right? You use it together, because after 3 months of using natural therapies, if let's say your cancer tumor was growing, but the speed at which it grew has slowed down. Well, it's working, but you might want to make sure that it works better, right? By taking on chemotherapy. Or even if you're doing natural therapy, your tumor is not shrinking, it is still growing. After 3 months, before it moved from second stage to third stage, this is the best time to say, let me explore chemotherapy. The good news is if you use Simply Nature liquid extracts, you will not suffer the side effects of chemotherapy. From our October event, Dr. Jimmy Katapia, who actually uses chemotherapy, shared very clearly to all the participants, his patients that were doing chemotherapy using our soft gel capsules and liquid extracts for those who have serious side effects for chemotherapy, were able to go through their chemotherapy very well with very much reduced side effects. So that's the option for you. So the answer is yes, if you follow rigidly, you can. Okay. Now, even if you do that, please, this is cancer. It's not about ideology. It's not whether you want to be a natural person or you want to be a drug person. The key is you want to be cancer-free, all right? So don't try to stand on one side or the other. Do what is best that gives you the best chance. So I would say go for the natural, but draw a red line. After 2 months, if the situation is not improving, please open yourself up. Go for a consult with Dr. Jansen and start to explore, or Dr. Jimmy Katapia, right, our oncological surgeon, because he will not tell you don't take supplements, because he actually knows how to work. And I'm actually talking to more and more. I was at the National Children's Hospital presenting a presentation to the doctors. And one of the pioneer pediatric oncologists of Philippines, she's now in her early 60s. So she's a very senior doctor, which everybody respects. She actually took up the mic and said to me in front of all the other doctors, she said, as a senior pediatric oncologist, she's very open to novel treatments, which means she said she's very open to new ways to treat cancer. So there are doctors, especially the senior ones, they are more experienced and they are open to working, So that's what I'm saying. All right. The answer is yes, but please, I want to be responsible to give you good advice, which is go fight naturally if that's what you really want. And yes, there is a good chance of success. And yes, we have had many patients who are successful at it, but do draw a red line. Do know when you should explore conventional medicine. This is why for Simply Nature, we have chosen to distribute our products not only to integrative doctors. Most of our doctors that we work with, almost 95% of them, are medical doctors, even though they have decided to use non-conventional methods, because medical doctors would know when to say not only natural, you are emergency case, please go to the hospital. I think that's that is something I will feel we want to be responsible to all our patients, right? Yeah. Long answer. Did I answer the question?
You actually said it very, very well, because this is actually a very common question. So thank you for throwing that question, Ms. Jocelyn Chua. All right, so let's just go first to the next question.
Okay, last
Okay, go ahead, sir.
Last thing to encourage Ms. Josephine Chua, all right? My Lola, Dr. Angie Tomondo that I mentioned, she had acute leukemia, which is very aggressive. She lived longer than her oncologist. She beat her cancer and she outlived her oncologist, and she did it naturally. She didn't do chemotherapy, right? So I think that's what Ms. Josephine Chua wants to hear, all right? That yes, you can successfully treat cancer without chemotherapy. Operation, on the other hand, for Ms. Josephine Chua, you operate on a cancer, the probability is the cancer, right? So, but when you go and operate on a cancer, what you're doing is that you straight away cut out the whole tumor.
Exactly. Yes.
Right? You already reduced, let's say the tumor is 5 centimeters, it's now 0 centimeters. And you only have to deal with the remaining cancer cells that are circulating in your body or in that area that is too small to be detected. So I just want to share with you that I think it's debatable whether you want to go for chemotherapy, radiation therapy, whether the timing is you can still avoid going for chemotherapy, you want to try natural first. But when it comes to surgery, my advice is actually go and speak to like Dr. Jimmy.
Yes.
Dr. Jimmy, during the panelist on October 14, someone asked him about surgery. His answer will surprise you. He will tell you, well, not every cancer case needs to go for surgery. Oh, wow.
Yeah.
Right? So many patients think that a surgeon will say, no matter what it is, cut. You know, everything, they just want to send you to the operating table. No, it's not true. All right. Specific types of cancer that you can do surgery for, there are others that you can't. And also, not everybody can actually do the surgery. It depends on where your tumor is, right? So sometimes if you are very blessed that the tumor is located in an area that's easy to operate, then go for the surgery, remove the whole tumor quickly. Then you just do the natural approach to kill the remaining small cancer cells, right? You don't have to fight the big tumor. Okay, now there are many cases where the tumor cannot be operated because maybe it's in a difficult position where it's hard to cut. And if the moment you go to stage 3, when your cancer spreads, right? And definitely in stage 4, it's too late. Even if you want to go for surgery, you can't, because it has spread to too many places. You can't cut open your body so many places. So again, if surgery is still an option for you, go ahead. And I asked Dr. Jimmy this simple question. You know, Sheila, if you think about surgery, what are you most afraid of? They're cutting you up.
Exactly. Yes.
Okay.
I'm
right?
pretty open.
Yes. So believe it or not, if you're cutting a chest, right, the incision or the hole is only 5 centimeters. They only make a 5 so small, because now the surgery techniques is like that. And if you have stomach cancer or colon cancer, if the cancer, depending on where your tumors are, they can even operate without cutting you open. That means they put the tube through your throat into your stomach. They don't actually cut you open. They send the tube in to cut. Diba? So you're not even opened up. All right. They send a little tube with a scissors at the end. You know, to simplify what I'm just saying. Yeah, and they operate this way. So find out more. So I don't know exactly about your condition, but I just want to say surgery is something that if your surgeon says go ahead. If you don't trust your surgeon, which I can understand, all right. Today Dr. Jansen is not here, so I will tell you, you know, sometimes I meet doctors that I trust, and I meet doctors that I'm not so comfortable with, right? So you, as a patient, you always have the right to find a doctor that you are comfortable with, right? So if you're not sure, you don't know a trustworthy surgeon, then I would recommend to you Dr. Jimmy Katapia. He's really good. How do I know? We actually sit outside his clinic sometimes waiting for him, and we hear his patients talk. His patients, so it's not what he said to us, it's what his patients are saying behind his back, that he's a very different doctor, very caring, right? Very trustworthy. So, okay, yeah, I'm taking too much time. Let's go to the next question.
All right, just before we go to the next questions, are very, very quickly, for those of you who wish to have a consult with Dr. Jansen or Dr. Jimmy Katapia, please just note down how to consult, and our dear Miss Beth will get in touch with you immediately. Also, please don't forget to follow our social media platforms, Facebook, Instagram, TikTok, and YouTube, so you can always be updated with the online events that we are having here at Simply Nature. Don't forget to share this live streaming right now to your friends and co-patients in your hospital, so that they can also be aware of great impact of PPARs on their cancer journey. All right, so for our next question, okay, this one, it's not about cancer, but the question is coming from Mr. Bien Almendros. Can PPARs also cure heart disease?
Oh yes, the answer is absolutely yes. All right. How does PPAR cure heart disease now, and how does this apply to cancer patients as well? I just want to answer, make this applicable to those who are viewing in for cancer, right? Okay. Number one, how does it for heart disease, right? So the heart disease is usually that your arteries are clogged up. Okay, so it causes a build up. So you need to put in a stent, you need a bypass, you're at risk of heart attack. All right, so it's got to do with your vein, your blood vessels being blocked. Okay, so when you take PPAR protocol, especially if you have a serious heart disease, then we will recommend you powder. It unlikely that we will ask you to take liquid. All right, powder is probably the best extract to take. Why? Because it can last longer, right? That means to clear your arteries, what the PPAR will do is it will reduce your inflammation. Once you reduce inflammation, your blood vessels become smoother. So it's just like Meron, if you go to the water park, right? If you go to Enchanted Kingdom or Disneyland, right? When you slide through the tube, if it's smooth, you slide very smoothly. If the tube is rough, then you sort of get stuck, right? So inflammation makes your blood vessels rough. So then the blood cholesterol will get stuck onto your blood vessel because your blood vessel is rough. So then it will start clogging up your blood vessel, and that's where you get heart diseases, right? You get a heart attack, you get embolisms and all that. So one of the things that we are able to do is, reduce inflammation. So your blood vessels all become smoother. Next is when your blood vessels become smoother, it also becomes more pliable, less stiff, right? It doesn't, if there's no build up inside, it becomes more flexible. Now, if it's more flexible, again, it means that it can expand and shrink, stretch, it can be stretched. So it will help alleviate, or it will prevent your heart attacks and your heart diseases. All right. Blood cholesterol is another reason why you have heart diseases. So the PPAR protocol actually lowers your LDL, which is your bad cholesterol, and improves your HDL. So in short, what does HDL do? HDL is known as the good cholesterol, all right? It's really not good and bad, but actually the function is just that HDL is the one that dissolves and moves cholesterol out of your system. The other one, it builds up. So they are both needed, right? Or else your body will not have LDL. You need LDL, but you also need HDL to manage your LDL, to put it simply. So when we increase the HDL, it will prevent the build up of your atherosclerosis, or to clog up your system. So it will clear your blood vessels. So that's how you are able to treat heart diseases. Now, I'll give you an extreme case. I had a friend who was admitted into hospital because he had a 14 centimeters. That's like, almost the length of your forearm, right? 14 centimeters. He had a clogged arteries that was almost clogged up, 14 centimeters blockage. So he actually took PPAR powder. Within less than a week, it shrank down to 7 centimeters. But he still had a stroke because he had an emotional shock, right? And of course it was a bit late. Even though we shrank the blockage from 14 centimeters to 7 centimeters, I just want to repeat, he still had a 7 centimeter blockage in his arteries. So he did finally, in the middle of the night, he actually had a sudden stroke, a sudden heart attack. All right, so he didn't survive. But if we could have, if he had taken the PPAR extracts earlier, if it could shrink from 14 centimeters to 7 centimeters within less than a week, imagine if he had taken it a month ago, he would have avoided. And in this case, I have another client, personal, right? Patient personal. Her name is Tita Bibian. All right. Tita Bibian's whole family, all her brothers has at least 2 stents. So all her brothers actually had heart operations. So she needed to have an angioplasty, which is they put a balloon into your blood vessel to clear the blockage. So she wanted to avoid angioplasty because number one, angioplasty costs 500,000 pesos, 500,000. That's the pretty standard fee. Now it might be even higher, right? So she wanted to avoid angioplasty, and also because she is in her early 60s. So any operation when you have to be under anesthesia for old person, yes, it's safe, but there's always that risk, right? So if you can avoid it, you want to avoid it. Now, and again, like I said, it's not like you have a cancer tumor. So if you can avoid it, then that's great, right? So again, it's to align with what I talked about surgery just now. Now, what she did, she called her cardiologist, right? The cardiologist was a very responsible cardiologist. The cardiologist actually told Tita Bibian, I have installed so many stents in your family members. So I think the doctor has installed at least 6 stents. He actually told her, I've made enough money from your family. I don't really wish to operate on you, all right? So she had asked him if she could delay her angioplasty for a month. And he said, it's okay, all right? So what she did in that 1 month, she took she started with Simply Nature PPAR liquid, 1 box. I'm not sure if it's 1 box or 2 box. If it's 1 box, it's 10 days. If it's 2 boxes, it's 20 days, right? And then after that, she went down to soft gel capsules and she was taking tablets along the way as well. After 1 month, she decided to still go ahead with the surgery. So what happened? She was pushed into the surgical room. Now, before you do an angioplasty, before the surgeon puts a wire and a balloon through your blood vessels, he will do another angiogram, which is like an X-ray to see your blood vessels, right? And guess what? Tita Bibian woke up, and what the cardio surgeon said to her is, I'm so sorry that I actually wheeled you into the surgery. Because when we wheeled you in there and we did a final check, the angiogram, we noticed your clog is no more there. Everything is clear. So she was all dressed up for surgery, but she was wheeled into the surgical theater and then she was wheeled out. She avoided her angioplasty. All right. So this is just to show you, to answer your question, can PPARs be used to treat heart disease? The answer is yes, it can. Okay. But if you are imminent stroke patient, the doctor say any moment you can have heart attack. What I want to tell you is, yes, you can still treat it with PPARs, but then I'll tell you, take at least the PPAR powder. If you know you could have a stroke any moment, I suggest the liquid. Okay. Now, also, please, if you are at risk of a heart attack at any moment, make sure you do go back for regular checkups. Okay, just don't because you feel good and you're taking. Don't say I'm taking PPAR, so there's no way I'm gonna have a heart attack. You know, I have patients that say that and then they go and eat lechon and whatever, thinking that they're taking PPARs and it's fine. No, that's very irresponsible. But I'm going to tell you that yes, you can totally manage your heart diseases with PPAR protocols, but you have to still go for your checkups with your doctor. This is what will happen when you go for a doctor. Your doctor will scratch his head. Huh? Your blood vessels were clogged up 2 weeks ago. What did you do? How come they look better and better every time I see you? So that's what's gonna happen, right? If you go on a PPAR protocol. But I just want to say to you, make sure you still go to your doctor for checkup. Okay? That's the responsible thing to do. Yeah.
Thank you for sharing that story, because I mean, it's not the only story that I've known. A patient took PPARs and then they were able to do away without the surgery. Just like with Miss Nesta, just like with Miss Tita Lynn of myoma and cysts in the throat of Miss Nesta. So those things, it's really, really possible, right? So thank you, sir. All right, another question coming from Ms. Ann De Castro. My husband is now 15 years lung cancer free. Is there a possibility that this will come back?
Okay, yes, there's always a possibility. Okay, so what will stop that possibility, or what will reduce that possibility? Okay, why is it a possibility? Are able to completely remove all the cancer cells from your body. Okay. our body produces cancer cells every day. However, our body kills the cancer cells every day as well. All right. When we have a recurrence, it's actually the same cancer cells from 15 years ago. It's not a new cancer, right? So for example, let me give, so maybe this is useful for our viewers, right? How come they say is breast cancer metastasized to the lungs? How come they don't say that you have now, you now have lung cancer also, because there are lung cancer cells in your lungs, right? You would think, maybe some people think a lung cancer cell, I have cancer cells in my lung, so I have lung cancer. No, no, no. It's actually breast cancer cells that went into your lungs. So your lungs has breast cancer cells, your breast has breast cancer cells, and then also your bone also start to grow breast cancer cells. So it's actually breast cancer spread to the lungs and the bones. Now, when you have a recurrence, it's the same cancer that from like 15 years ago came back. So if it came back, it actually means it never left. Right? It's very different from I had lung cancer, then 15 years later, I have prostate cancer, which is a totally different cancer from 15 years ago. So you are asking a question, is that possible for that cancer to come back? The answer is yes. Now the reason is, okay, why does some people come back very fast and some people never comes back? Perhaps an important way to understand is this thing called doubling time. How long does it take for your cancer cell to double in its size? Okay, I want to ask, I give you an example I give you an example of how fast, what's the difference, right? Imagine, okay, rice. We all know uncooked rice, right? Uncooked rice, okay. If you have one grain of rice, only one, and then every minute you times 2, or every hour you times 2, right? Every hour you times 2. So, okay, you have one rice. 1 hour later, you have how many? 2. Okay, 2 rice. Okay, 1 hour later, 2 times 2 is 4. 4. All right. So you can see, for you to feel tabo with rice, starting from 1 grain of rice and doubling every hour, it will take more than a day. Yes. All right, it will take more than 24 times of multiplying, and it probably still won't feel the tabo. Diba? Okay, what if you start with the half a tabo of rice? What if you start with half a tabo of rice? How long will it take for the tabo to fill up?
It'll take a short while.
No, not short one. 1 hour. You just times 2, right?
Yeah,
half
yes.
Times 2.
Double, yeah.
1 hour later, your whole tabo is full of rice.
Double, yes.
Everybody, you get the idea? So if you only have 1 grain of rice, it will take a long time for that tabo to be filled with rice, because it takes every hour it times 2. It doubles, right? So it takes a long time for 1 grain of rice to fill a whole tabo of rice. But if you start with half a tabo of rice, it just takes 1 hour. It will double, it will fill up already. So that's how cancer works for recurrence. That's one of the ways it comes back. If you had gotten rid of most of the cancer cells, for the cancer to become a tumor again, it's going to take it 25 years. Yes. So it will take longer than your remaining lifespan. You get what I'm saying? And maybe if you only have very few cancer cells, every day your body kills enough of it that it doesn't really grow. Yes. But if you were not able to clear your body of most of the cancer cells, even though when we go for your test results, right, there is it says that you're cancer-free. It doesn't mean that you're cancer-free. It only means that they cannot detect the cancer. It's too small, but it's still there. So it depends on how many cancer cells were left over after your successful fight with cancer. So there are 2 strategies, right? This is the reason why your doctor will advise you to go for chemotherapy after you are cancer-free. It's kind of strange, right? Why, if I'm cancer-free, why do I need to go for chemotherapy? Because the doctor is not explaining to you. When he says you're cancer-free, it just means he cannot detect the cancer cells. But he believes that there are still cancer cells that are too small to be detected. That is why they ask you to go for chemotherapy, just to be extra safe and kill a few million more of these cells, so that it will take a long time for the cancer to come back, even if it does. All right. So, so 2 strategies. Make sure the first round when you fight cancer, you kill as much of the cancer as possible. Number 2, if your immune system is very strong, then it will keep killing the cancer cell. So whatever cancer cell that is left never gets a chance to grow big. Every time it grows, your immune system comes and give it a Pacquiao knockout punch, right? So every time it's about to stand up, Pacquiao comes around and gives him another punch. So that cancer cell never gets to grow big, right? It doesn't mean that the cancer cell is not there. So very important for all cancer survivors, your immune system has to be very strong. The good news is that your immune system should be able to recognize that cancer cell already, because it's an enemy that it fought before. Maron, COVID vaccine. If you got COVID, for the next 6 to 8 months, you won't get COVID again, because your body recognizes the COVID virus. So at the moment it sees the COVID virus, pop, pop, go there, whack it, right? Now, the same is for your immune system for cancer. If your body was successfully fought 1 round with this cancer cell and beat it, it knows how to recognize that cancer cell. So it will do a good job of keeping that cancer cell under control, right? However, why do some people have recurrence? Maybe because you're stressed, right? You didn't sleep a lot. You went through emotional stress. So your immune system got weak for that moment. How many of you notice if you argue with your wife or something like that, and you had a big argument, you got so depressed, suddenly it's very easy to get flu, right? You get sick easily when you're emotionally weak, right? Because you feel so drained. So your immune system gets weakened, the flu virus has a chance to hit you. So it's the same. Let's say you're doing very well, the cancer doesn't come back, but maybe there was a trauma, or literally sometimes a physical accident. Like, for example, old people, when they fall down, all the energy is then diverted to try and repair the broken bone or the broken wound, right? So the immune system gets compromised because the body doesn't have enough energy to repair the bone and maintain the immune system at the same time, right? So what happens is then the cancer gets a chance to move forward, all right? So what we can do to stay cancer-free is to keep healthy. So if you keep healthy, yeah. So is there a likelihood that your husband's lung cancer will come back? If you were able to stay cancer-free for 15 years, I would like to say that if I had to bet, I would bet that your husband will stay cancer-free. All right? Why? He was able, because he was able to maintain for 15 years. So whatever he's been doing right this last 15 years, please keep doing it. So he will be cancer-free for the next 15 years also. Now, of course, as we age, our immune system gets weaker naturally. It's just like any car or, and anything. As we grow older, it gets slightly weaker. So what you want to do is to be even more health conscious, right? So as you age, don't stress yourself as much. Learn to be happy, learn to forgive, let go, and, don't be emotionally stressed. Take PPAR tablets or even soft gel capsules once in a while to keep your immune system boosted up, right? The older you are, you use external ways to help yourself. And of course, as you grow older, stop eating nonsense, right? When you're young, you can eat nonsense and still be okay. But as you grow older, every time you eat nonsense, it stresses the system, all right? So I hope that will give you a way to keep yourself, how shall we say, cancer-free. So I have faith that your husband will stay cancer-free because he was successful in doing that for 15 years. So I hope what I share with you gives you and the other viewers an understanding why some people get recurrence, what causes the recurrence, why does the same cancer, which was not around for 10 years or 2 years or 6 months, why did it come back suddenly? And not only did it come back, it appeared in more than one place, right? It was only in your breast. Then when it came back, it was not only in the breast, it's now in the bone and the lungs. because it was the same cancer cell that was circulating all over your body.
Thank you, Sir Shyan. That is why, in different phases of the cancer, we have different goals. And for this one, on your case, for your husband, the goal is for it not to come back. Okay?
Yeah.
All right.
Sorry, Shreya. Connected question, right? Miss Doreen.
That's actually, yes.
Oh,
that's our last question for today. Yes.
All right,
yes.
why don't you read the question and I will answer.
All right, this will be our last question for tonight, coming from
Yes, all right, because I've answered about an hour of questions already. So,
thank you, sir. All right, good evening, guys. Watching from Malino, Bacoor. I have breast cancer last 2020, and I have undergone chemo and radiation. But last July, it metastasized to my brain. So my question is, how can you help me, and what is PPARs? Another viewer is actually asking, what is the ingredient of PPARs? Maybe you can answer it together.
Okay. If I answer this question completely, it's going to take another half an hour. So I'm gonna go straight to the crux of the thing. And our customer service officers, Sheila, Jen, and April
and Jessa. Yes.
All right, then please continue the conversation with them. Okay, but I'm gonna give the quick. The important points. Right? Number one, take a look. For Miss Doreen, her cancer was 2020, right? So that means that was 3 years ago. So I assume at some point, 2020 or 2021, or maybe even 2022, she was cancer-free, or her cancer was under control. So last July this year, 2023, she said that it metastasized to the brain. So the way the sequence 2020 and then 2023 July, maybe it's like a surprise. I thought I was doing well. I thought the cancer was under control. How come it suddenly metastasized to the brain, right? I think my explanation the last 15 minutes help you understand why, right? That cancer cell had already gone to the brain, but it takes some time for it to become detectable, all right? So what can we do? Okay. When cancer spreads, surgery usually becomes no longer possible. Okay, because you can't cut yourself in 8 different places, right? When the cancer was only in 2 locations or in 1 location, 2 tumors side by side, right? You can do surgery. But when the cancer has spread to the bones, how do you do surgery on the bones? You can't. When the cancer cell has spread to the brain, it's no longer the same, right? For the brain, not every part of the brain can be operated on. So, and if it's already spread, it might be more than 1 location. So no point cutting up to do brain surgery in 3 or 4 locations. That will do a lot of damage, right? So this is why I go back to my earlier answer tonight. If surgery is an option for you now, do seriously consider it, because once the cancer spreads, even if you want to do surgery, it's no longer necessary because it won't help. All right. So when you can still do surgery, surgery is actually quite important. It's quite a powerful way to deal with the cancer. Okay. Now, what can PPARs do for your metastasis? Actually, PPARs is probably something you have to definitely start on straight away, regardless of what else you want to do. Okay. Number one, because your cancer has metastasized. So it's the same cancer that was from 2020. Because you have done chemo and radiation. So again, here's the downside. Okay, because it's a cancer that has spread, it means it's the cancer that survived from 2020, which means there's a good chance the chemotherapy drug that you use successfully in 2020 won't work anymore. Okay, very few people die from first-time cancer. Most people die from a recurrence. Okay, because today, if you listen to Dr. Jansen share, the successful treatment rate of cancer is very high. It's like 60%, 70%. If you catch it in the early stages, it's like 90%, right? That means most people actually, more than half of the people actually recover from cancer. So actually, those who actually still end up dying from cancer is when the cancer recurs. So they survived the first round, but the second round, they couldn't win the battle. Now, why is that the case? It's because this cancer is the survivor of the first cancer. So the cancer has learned to adapt to the chemotherapy drug that you used before. Okay, so whatever worked in 2020 will not work now, because this is the one that has experienced the first round of chemotherapy and yet was able to survive. So this time round, it's unlikely that that chemotherapy will work. So your doctor will probably prescribe you new chemotherapy drugs. All right, and if they don't have options, then you might end up with some experimental chemotherapy drugs. So the cancer might have a chance to may not have adapted to it. All right. So I hope tonight my answers are giving everybody a better idea of what's actually happening, why the treatments is not working, or why did it work, how come it's not working now? Because it's the same cancer cell, it's experience. It's just like vaccine. Do you realize now the hospitals and the doctors are telling us the COVID vaccine that we variant.
True.
Right? You have to use the new vaccine. Why? Yes. Because the COVID virus has mutated, has adjusted to the vaccine from 2020. So you must use the new vaccine. So, but it is the same COVID virus, right? I mean, it's the virus that first appeared in 2019, but it changed. It adapted to all the vaccines. So the same for your cancer cell. When it metastasized, when it came back, it has adapted to the original chemotherapy you use. So that's not going to be as effective, or maybe not even effective anymore. Because of that, your first line of defense and attack is actually your natural immune system. Because our natural immune system is adaptive. Our immune system will adapt to the new cancer. So as the cancer changes, so does the way our immune system attack it. All right? So the difference between chemotherapy drug and your natural immune system is that your natural immune system can change together with the cancer. The cancer change, but your natural immune system has a chance to also change and catch it again, right? So your first line of defense now is your natural immune system. So if you can strengthen your natural immune system, if you can increase the detection power of your natural immune system, then that's your first line of defense, right? So that's what our PPARs protocol does. To answer the question, what is PPARs? PPARs are gene activators. They are transcription factors. So I'm being very technical here, but basically I think the easy way to understand it is it's a gene activator. It activates the genes that control your immune system to make your immune system more active. This is the simple explanation. If you want to go for an in-depth explanation, go to our YouTube channel. Okay, go to Simply Nature International YouTube channel. Take a look at the Doctors Forum. So in those Doctors Forum, I explain PPARs in a more technical, detailed manner. If that is your interest, then please go to our YouTube channel and take a look. Now, if you just want to know the quick answer, it's a gene activator. It activates your genes to activate your immune system, make it more adaptive, make it more active, and that is how your immune system can adapt to fight the metastasized tumors in your brain, all right? Because your own immune system can adapt. Next, since your cancer has spread, you want to make your body as hostile to the cancer as possible. So what makes cancer cells grow fast? Inflammation. Okay, why? What is inflammation? If I punch you and your face gets swollen, that's inflammation, right? So an easy way to remember is your face become red and swollen, right? That's inflammation. What is inflammation? Inflammation, why if I punch you, why does it become red and then swollen? Because your body sends lots of blood to the area to do what? Repair. Does it only send blood? It also sends lots and lots of nutrients so that the body can make repair to the damage of the punch. That's why it's swollen. full of nutrients, full of blood. Now I hope you can quickly understand yourself, make a good guess why cancer will grow if you have inflammation. Because there's lots of blood and lots of nutrients for the tumor to feed on, right? That's why inflammation helps cancer grow, okay? That's why you want to reduce inflammation in your body, and that makes your body more hostile to cancer. Now, ultimately, once you have a tumor, how does the tumor grow big? It will create its own blood vessel. That means the cancer cell, when it becomes a certain size, it's not enough to just take nutrients from the inflammation. It will create its own blood vessel and plug it into your blood vessel system. It will like suck its own blood. It will create its own straw to suck blood to get more nutrients. Now, when you have inflammation, okay, in an area, the cells and the nutrients and the microbiology part, all right, the cell biology part, it encourages the formation of blood vessels. Why? Because imagine someone punch you, so your skin break, everything is like broken. So the body needs to create new blood vessels to repair, right? So that's why it's inflamed. So we understand when you have inflammation, that area is easy to form blood vessels because you need to do repair. So can you imagine if you have chronic inflammation in your body, it's easier for the cancer cell to create their own blood vessels because all the material is there. Because it's needed for repair. But when you have chronic inflammation, that means inflammation for no reason. All right? It's not because someone punched you, it's because you ate too much electron, your body's acidic, you're stressed. You are always stressed, so your body is always inflamed. Now that promotes the growth of cancer, right? So you want to cause our PPAR inflammation. Right? It helps you modulate inflammation. So it's very good for COVID. So those of you who after COVID find that there's pains here and there, that your hair is dropping for the ladies, I think, this is a common complaint now, quite clear. Those who experience COVID will experience hair loss. Okay, so there's chronic inflammation, all that issue. Taking PPARs helps you to lower your inflammation. So just these two alone is going to help you fight your metastasis to the brain. Okay, is it enough? Just taking extracts, is it enough? It may be enough, but don't stop there. All right. So after you take the extracts, monitor it, eat healthy, exercise. That means do walking, drink lotions. If your doctor recommends treatments, go for them. They work well together with recommend. And that. So from there, and then if suddenly you met someone who says, let me teach you Qigong, it will improve your no. So go ahead. Go ahead, yes. Right? Yeah, don't just stop at this, all right? But if you're not sure, okay, now be careful about taking supplements, okay? Now I sound like an oncologist, okay? Because sometimes when you go to like direct selling company and they just want to sell you a product, so they will say it works, but there's no science to it. There's no doctor backing them up and things like that. So be careful about that. If you're not sure whether a supplement is good for you, you can always watch us again next Thursday, right? And ask us, is turmeric good for me? Is this good for me? And then I'll let Dr. Jansen answer your question, okay? So things like turmeric and all that, they're actually very good for anti-cancer. So these are things that you can also take in addition to Simply Nature PPARs.
Thank you, sir. Very, very quickly, just to recap what you said, sir, with the inflammation, this actually best explains why, on the part where your cancer is, it's where it's where you can find the angry nerves because of inflammation. And this is also explains why people who are taking PPARs, this is the first thing that they notice. These angry nerves that causes inflammation are the first ones that disappears because it's
okay.
being cut down.
Yes, yes, absolutely right. I don't suffer from this, so I forget that these are the symptoms that Sheila deals straight with the patient, so that's why she can share with you the patients. Thank you, Sheila, for sharing, because you're always talking to patients. So these are the first hand that you have. I see Alan Saprosa asking, can we take PPARs during chemo? Yes, you can. In fact, that's the best time to take during chemo. Now, in case Sheila, just ask you, when Dominic was undergoing chemotherapy, when did he take the liquid extracts?
He first started taking the liquid extract the day before her first session.
Okay, so one way, the safest way to take chemo and PPARs is one day before and one day after. Okay, why? It's not say safe. It's the most cost effective. Why? Because in reducing inflammation and all that and protecting your body, we just want to give one day to chemo to do its damage. Because the chemo will also do, you get what I mean? So let strengthen your protect all the healthy organs, and then on the day that you take chemo, let the chemo do its work without interruption. So you will feel pretty crappy. You'll feel some of the side effects coming, when you go home, feel uncomfortable, nausea. You know what? Maybe before you sleep, you take your liquid extract. All right. So you gave 12 hours, 8 hours for the chemo to go around and do its damage to the tumor and also start damage. After you've given them, that's the damage. The chemo is not supposed to damage your body constantly, right? That's why you take one session, then wait another week before you take another. It's not like the whole week the chemo is still damaging your tumor. No, it's that first day that chemo hits the tumor and the tumor is being damaged. And then 1 week later, they hit it again, all right? So in between is the time where you can go and protect and repair all the damage that it did to the healthy organs. So one good way to use to combine chemotherapy with our product is take it before so that your healthy organs are protected. And we actually tested our products against oxaliplatin and cisplatin, which is chemotherapy drugs, the most commonly used chemotherapy drugs. If you're going for chemo, you probably have a cisplatin or oxaliplatin in your cocktail or a similar platinum-based chemotherapy drug. So what we found out was that it protected the bone marrow from damage from the chemotherapy. So this protects your own immune system so that the chemotherapy doesn't damage your immune system. This again ties back to the recurrence, right? Whether later your cancer will come back or not. If your immune system is damaged, then of course your cancer will come back because nothing is defending your body after that, right? So I think everything I say tonight will start to click together. It forms one picture, one complete picture with different parts. I hope it's not overwhelming for you. But in short, yes, take it during your chemo. It's the best thing. In fact, Dr. Katapia, for his patients who are undergoing chemo, he prepares them by taking soft gel capsules. Okay? He takes them soft gel capsules. So why does he choose soft gel capsule? Because he doesn't assume that you will react badly to chemo, right? So he starts with the most basic boosting and protecting of your body, preparing you for chemotherapy. So he uses soft gel capsules, okay? Now, if his patient takes chemotherapy while on soft gel capsule, no side effects, then he says, this patient actually is, soft gel capsule is enough to protect this patient. Now, if the patient on soft gel capsule goes for chemotherapy and yet has complications, then he will boost it up to liquid extracts.
Yes.
And this is a cost-effective way of managing your chemotherapy sessions, because the soft gel capsule is cheaper than the liquid, right? But if you are a tycoon, or if you have very loving children, it could be your children love you so much, or your husband or your wife love you so much, say, dear, let's start with the best so that you have we don't take any risk. All right. Then if money is not an issue, the best way to protect yourself during chemotherapy is the liquid extract. All right. That means you take the best protection, right? It's like going to a fight with a machine gun. Okay. Nobody will beat you. All right. But if you go to a knife fight and you have a gun, you will already beat the guy. But if you have an assault rifle, he has no chance. right? So that's what it means, right? So that's how you will go about chemotherapy and Simply Nature PPAR protocols. Please, if you are going for chemotherapy or even immunotherapy, please take Simply Nature PPAR extracts. Start with minimum soft gel, all right? If you can, if your case is more serious, then the powder or liquid, okay? It works well with chemotherapy and also immunotherapy. I don't have time to go into the technicalities, but maybe if you ask this question next week in the beginning, then I have enough time to explain. Yeah.
Yes, that is why I just want to quickly say that we appreciate patients who are really telling their budget constraints or expressing their budget concerns to us, though, so we can also help you out with what or which protocol is the best for your case, and of course for budget considerations as well. Okay, sir, very quickly, all right, as you know, our viewers for tonight are combinations of patients just diagnosed, on remission, on chemotherapy journey, or diagnosed with cancer. What can you say? Can you please give them a very quick part?
Okay, so my first parting words, I guess, if Dr. Jansen was here and Dr. Jimmy was here, they will tell you one thing. Do not do nothing. Don't do nothing, all right? If you have cancer, act immediately, take the right actions, okay? So what are the things that you can do safely even without consultation, okay? First thing you can do is to start on soft gel capsules and the tablets, right? But I would definitely, that is if you're going to go for, if you intend to go for chemotherapy and surgery, right? Now, if you actually want to try to treat your cancer naturally, please start with the powder extract and tablet combination. Now, please ask the customer service officer why I combine these two, all right? They will explain to you. One provides the nutrients, one is actually the gene activator. Okay, even before you explore anything, even if you intend to consult with Dr. Jansen or any of our doctors, start already on this. Why? You start on this, your body starts preparing already. So by the time you see the doctor, by the time you go for your next scan, your second scan, I assume if you are talking to us, you already have the first scan, which is why you have a cancer scare. Someone says, okay, I think you have cancer because you had an initial scan, right? You definitely did something and they noticed something. So that means that when you go and see a doctor or you take a next step, they are going to ask you to do another scan so that they can know whether the tumor, did it grow from the first time you noticed that thing? Was it a mistake? Did they misdiagnose you the first time, right? So they will always make sure before they start you on any treatment, they will ask you to go for another scan so that you will know where your condition is. So start today, right? If you know you have cancer and you're not going to go for chemotherapy, or you're considering, should I go or not go? I haven't decided yet. Then what you want to do is take immediate action. Go on the PPAR powder. That's the one that is the basic, all right? And if you are sure you want to go for natural, then go for the liquid month and then tone down to the powder, and then do a scan, right? Before you go down to the powder, do a scan so that you know how effective the liquid extract is for you. All right. So that when you go down to the powder, why from liquid go down to powder? Very simple. The powder is cheaper than the liquid. All right. So I'm very honest with everybody. I want to give you good advice. You want to make sure that you can continue your cancer therapy. You don't want to start something and then halfway say, oh, I ran out of money. That's terrible, right? It's better to do, so you got to plan right from the beginning, something that you can manage, because cancer is not succeeded. No, that's why we always hear the horror story. Thought money, you have no more money for the second round. So that means that the strategy for dealing with cancer is, and that's what we hope. That's what we hope for all our patients, that we can give you something that we want to take the extra effort to also manage one more thing, your finances. So we want to give you the best advice that we can, right? Go for the strongest right away, but after that, quickly move to a manageable one so that you can save as much money, all right, and see whether the lower dosage actually works. If it works, then okay, praise God, you're reacting well. You don't have to buy the most expensive and the best, right? Now, and then things go well. If things suddenly make a turn for the worse, at least you have money to go back up on the stronger one. If everything continues to go well, you have enough money to sustain so that you go all the way until you are completely cancer-free, right? So I think this is something that we want to do for you as well, to give you good advice, right? And not just say take the most expensive straight away and nothing else. I don't think that is, we want to help you beat your cancer, okay? So immediately, if you're going to go for chemo, start on the soft gel and tablets, okay? And then if you go for chemo, you still feel very bad, then consider moving to the extracts, right? If you move to the extracts, you might want to go straight on to the stronger since you already tried the soft gel. Go to the liquid. If the liquid makes you feel good, wow, then that's great. The side effects of the chemotherapy drugs are now manageable. You might want to try to go back down to the soft gel. Maybe you just need to cross the hurdle, right? Then after that, your body can take the chemo already. Diba? So then you can go back to the soft gel, right? So these are different techniques, dosages, protocols that you can do. Our CSO can advise you. Now, if you want to go natural, go straight for the extracts. Minimum powder. If money is not an issue, do the liquid. Okay. And always pair it with the tablets. Last question, this one. My 3-year-old has been taking PPAR powder. Is there a limit for taking it? No. There is no limit for taking it, right? So why do we say that with such confidence? Okay, we have done our LD50. LD50 is lethal dosage 50 times, okay? So we have done these tests. I don't know of any other natural products that have done these tests. So we do these tests because these are the tests that are necessary for doctors to have confidence, because they want to know, if my patient takes a lot of this, is there toxicity? Is there a side effect that builds up, right? 1 dose is okay, 1 month is okay. What if the person takes for 6 months? Or what if the person accidentally takes a lot, right? So is there can you overdose on this? These are the questions that doctors will ask. And because we distribute and we dispense through doctors, we took the effort to do such tests. So as this Charmaine has said, he has an inoperable brain stem tumor. Okay, taking PPARs while on radiotherapy. So for Miss Charmaine, Jane, please update us. I don't know who is the one that serviced you, whether it's Sheila or April or Jen, but please keep us updated so that number one, we can pray for your 3-year-old. And so that if there's anything that happened, let us know. We have many doctors from all experts, from pediatric oncologists to surgeons to lifestyle medicine doctors to integrative doctors, so that if anything happens, we have other resources that can help you, right? So I think I'm going to steal the line from Sheila. She's the one that always said, right? So, but it's something that we try our best. We also have our limits as a company and resources, but wherever we can, we do our best to follow, to be with you from start to healing. All right. So please keep us updated how your 3-year-old is doing. I hope that the radiotherapy, he's reacting well and he's not experiencing too many side effects because of the PPARs protecting him. So do let us know. I know it worked very well for Dominic and our other children who undergo chemotherapy and radiation therapy. So with that, many questions. We'll be here next Thursday to answer them again. And next Thursday, I believe Dr. Jansen will be joining me. So you can ask a lot of the specific medical questions as well, not apart from PPARs. But tonight we focus on PPARs because that's my area of specialty. So I wish you all a wonderful rest of Holy Week. It's great time for all cancer patients to, lean onto the Lord. As much as I believe Simply Nature PPAR protocols will heal you, I want to say that healing actually comes from the Lord, right? So spend time with the Lord, and I'm sure your cancer, you will do well, especially if you use PPAR. Okay, right, everyone, have a good night. And Sheila, thank you.
Thank you, Sir Sean, for answering all the questions for tonight. And of course, I'll definitely see you next week. But I have to invite everybody on our next event. But before that, I just want to say great news, everyone. You can still avail of our Power Pack and Kickstart gift packages for daily detoxification and immune system booster through Complete Nutrition. The management has approved the buy one, get one free, so don't wait for the Christmas rush to get the best gift of health. This is perfect for your parents who are on a maintenance medication, all right? And for, of course, but as a mom, you know, I try as much as I can to also be healthy because I understand how worth it is to be healthy for your whole family. Okay. Once again, for those of you who have questions about PPARs, I'd like to introduce all our ladies who are servicing our clients and patients here in Simply Nature and also Simply Healed Medical Group. And for Simply Healed Medical Group, we have Miss Beth. And for Simply Healed, from Simply Nature International, of course, you have me at your service, Sheila. You also have Miss Jen, Miss Jessa, and of course, Miss April. Our contact numbers are there in your screen. And so please do save us. We are not a networking company, so you are directly speaking, right? If you are messaging them, you are really directly speaking to a staff of Simply Nature. All right. Once again, please don't forget to like and follow our Facebook, Instagram accounts, and subscribe to our YouTube channel so that you can always be updated not only with our Doctors Forum webinars, but also with our patient success stories. All right. And of course, our product reviews as well. All right. And of course, as mentioned a while ago, all right, I hope to see you once again next Thursday, same time, 7:30. That's November 9. The webinar, our webinar next week is entitled Overall Solution for Prostate Cancer and Diabetes. So please don't forget to share this next Thursday's event to your fellow patients or loved ones who are suffering from prostate cancer or diabetes. All right. Okay. So once again, thank you so much for joining us tonight. And we really hope to see you once again in our next webinars to come, because here in Simply Nature, we are always with you from start to healing. Thank you, everybody. Good night, and God bless you all.
Pagpa-check up ko kasi lumaki po yung tiyan ko. Doon ko po nalaman na yung cancer ko daw, numerous to count na siya. May nakita daw po ulit na bukol sa diaphragm. Iyak na naman po ako. Sabi ko, hindi pa nga magaling yung sa ibang organ ko. Tapos ito na naman. Pero ako that time po kasi kapag naiisip ko yung taning ko, parang ang sakit po. Like, nakikita ko yung papa ko na lumalaban. Pero yung katawan ko, pakiramdam ko po kasi sumusuko na kahit yung utak ko, yung puso ko, gusto ko lumaban. And I'm so happy po na nitong latest na CT scan ko noong July, tuwang-tuwa po si Doc Jansen kasi talagang nakita po niya na lumiit po talaga yung tumor ko. And masayang-masaya po ako doon. Ngayon po, gusto ko lamang po pala ipaabot ang aking pasasalamat kila Doc Jansen and Mr. Shyan. Maraming salamat po talaga kasi alam ko po talaga nakatulong po siya sa akin at alam ko pong mas lumakas po ako. And sabi nga po ni Doc Jansen na kahit slowly siya, sure naman po talaga nagagaling po ako. Kaya maraming salamat po sa walang sawang pag-support po sa akin.